Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough to be classified as type 2 diabetes. So, the person is somewhere between normal and diabetic. This happens when the body isn't able to use insulin properly, leading to higher than normal blood sugar levels. This is called insulin resistance. Insulin is the hormone responsible for keeping your blood sugar levels within normal range. If there's problems with insulin, then your blood sugar levels will be elevated. There are many risk factors that increase the person's likelihood of becoming prediabetic, then developing diabetes. Some of these risk factors include obesity, a sedentary lifestyle, poor diet, family history of diabetes, and age where those over 45 years are commonly affected. Do these risk factors apply to you? Well, have no worries. Luckily, with adequate lifestyle modifications and medical management, prediabetes can usually be reversed back to normal, and its progression to type 2 diabetes is prevented. This is why in this video, we will reveal to you how to stop prediabetes from turning into diabetes. Without further ado, let's get to it. Number 1. Eat a healthy diet. One of the most influential factors in controlling prediabetes is diet. Having a healthy diet is crucial to regulate blood sugar levels and reduce insulin resistance. So, what should your diet contain? Certainly include fruits and vegetables. Remember that the more colorful your meals are, the healthier they are, and fruits can be a healthier alternative to desserts. Aim for non-starchy vegetables like leafy greens such as spinach and kale, broccoli, and peppers rather than starchy vegetables such as potatoes and corn. Moreover, opt for whole grains rather than refined grains. Examples of whole grains are oats, quinoa, brown rice, and whole wheat bread. These foods have a lower glycemic index, which means they cause a slow and low rise in blood sugar levels. So, they help keep it within the normal range. Other foods you could increase in your diet are lean proteins found in chicken, fish, beans, and tofu. Lean proteins take a while to be digested by your stomach, so they stay there for longer and give a sensation of fullness. This can decrease the person's carbohydrate intake. Number 2. Get regular exercise. Getting regular exercise can go a long way in reversing prediabetes. Your weekly goal should be at least 150 minutes of moderate intensity exercise. You can divide however you like, with at least 30 minutes of moderate intensity exercises per day. Some examples are brisk walking, cycling, swimming, or dancing. Such exercises are called cardio because they get your heart rate up. In addition to cardio, make sure to add strength workouts. These can be in the form of using free weights, machines, or resistance bands to perform exercises like squats, lunges, and bench presses. If you don't have access to such tools and machines, you can still do push-ups, pull-ups, and plank exercises. Number 3. Manage your weight. We can say with absolute confidence that weight loss and management can guarantee the reversal of prediabetes in most cases. Can you imagine that even a small amount of weight loss, as little as 5 to 7% of the total body weight, can tremendously improve blood sugar levels and decrease the risk of developing diabetes? This is because obesity is one of the main causes of insulin resistance. Obesity results in an increase in the size and number of fat cells. These fat cells secrete inflammatory molecules that affect how insulin impacts your body cells. Your body cells then don't respond to insulin, and your glucose levels will remain high. Losing weight decreases the fat cells releasing inflammatory molecules, and so decreases insulin resistance. Now, you can achieve weight loss via a combination of diet and regular exercise that we explained earlier. Number 4. Regularly monitor your blood sugar levels. Monitoring blood sugar levels and regular medical checkup appointments are vital for controlling prediabetes and halting its progression to diabetes. It's useful to have an at-home glucose meter or glucometer. This is a device anyone can use to measure their own blood sugar levels. Simply massage, then sterile certain areas, then use the needle that comes with the device to draw blood. This blood is then inserted into the device, and a numeric figure is given that stands for your blood sugar level. Owning such a device is handy in measuring the sugar levels in the body after meals. It's also essential to measure your fasting blood glucose levels. This is done by measuring your sugar levels after an 8-hour fast. Additionally, the HbA1c test must also be done to give an average blood sugar value over the past 2 to 3 months. These tests must be regularly done, and the results must be checked with your doctor to devise a suitable management plan. Number 5. Have healthy lifestyle habits. Having healthy lifestyle habits is done by refraining from habits that can increase and worsen prediabetes and adopting beneficial habits instead. One place to start is quitting smoking and alcohol drinking. Alcohol should be limited to up to 1 drink per day for women and up to 2 drinks per day for men. This is because both smoking and alcohol are associated with increasing the risk for diabetes. You can use nicotine patches or nicotine gum to help you quit smoking. Also, you can adopt some healthy habits, such as taking the stairs instead of the elevator, using a standing desk to work, and doing household chores. Because they make you move your body, these healthy habits can lower your insulin resistance. Even though these may seem like little things to you, however, don't belittle the effect they can have on your blood sugar levels. You'll be surprised. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Take helpful medications. Thankfully, nowadays modern medicine has reached astonishing levels of advancement. There are numerous medical drugs that can be used to lower and control blood sugar levels in case of insulin resistance. Your doctor can guide you to the best medication according to your needs. Please consult the doctor before taking any medications. Your doctor will usually ask for blood sugar tests, such as fasting blood glucose results and HbA1c test. The HbA1c test is the most important test as you can be categorized according to its result as normal, prediabetic, or diabetic. Along with the medications, you must constantly monitor your blood sugar levels after meals to avoid fainting due to low blood sugar. Number 7. Decrease stress in your environment. High levels of stress lead to high blood sugar levels. This is why decreasing your stress levels is of great importance. Stress triggers the release of the hormone cortisol from the adrenal glands. You may know cortisol by another name, which is the stress hormone. One of the many functions of cortisol is elevating blood sugar levels by a process called gluconeogenesis and glycogen breakdown in the liver. Gluconeogenesis is the synthesis of glucose from non-carbohydrate sources, such as proteins or fats. This is especially problematic in case of prolonged stress, where sugar levels become elevated for long periods of time. Over time, the body cell's sensitivity to insulin is reduced and insulin can no longer properly perform its function. Furthermore, stress also increases the secretion of catecholamines, such as adrenaline and noradrenaline. These hormones inhibit insulin secretion and action. The end result is a reduction in the ability of cells to take up glucose, so higher blood sugar levels and insulin resistance occur. Not to mention, those under constant stress tend to engage in emotional eating. This leads to obesity and higher risk for diabetes due to increased carbohydrate intake. If you have a stressful lifestyle, try including activities that can lower your stress levels. Some examples include yoga, meditation, or deep breathing exercises. Moreover, it's immensely crucial to get between 7 to 9 hours of restful sleep each night to decrease stress levels the next day. These were some useful tips to stop prediabetes from turning into diabetes. It's worth pointing out that you don't have to be prediabetic to follow these tips. Even if you're not a prediabetic, these tips will decrease your risk of becoming one, especially if the risk factors apply to you. Have you ever, or anyone you know, been a prediabetic? Was the condition reversed? If so, did you do any of the tips mentioned in this video? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.